Hello guys, this is Vamshi Krishna. So in this class today we will see some of the psychiatric disorders, okay, which are very important in the psychiatric nursing subject. So let's enter into the topic. So first disorder is agoraphobia. So agoraphobia, it is nothing but it is a panic disorder. Okay, panic is nothing but overthinking and some kind of exciting mood behavior, changing of the mood behavior, increasing very tense and anxiety. So it is called panic is nothing but overthinking and emotions. So it is involved intense fear and avoidance of any place or situation. So in this picture you can see that a woman is feeling of fear. Okay, by the seeing the picture of the woman we can understand she is fear about the crowd. Okay, so other people are surrounded her, so it is nothing but agoraphobia. So these situations may include driving, okay, any driving car, vehicle or anything, and in the shopping and crowded places, traveling, standing in the line and meeting social gatherings, and even being alone. So when they are being alone also they will have a fear. Why? Because no one is here. If anybody comes, what they will do? So they will fear like that. That is nothing but agoraphobia. Agoraphobia is nothing but it's a fear disorder. So the next disorder is delirium. Okay, so delirium is a serious change in the mental abilities. Mental abilities are nothing but capabilities to do something. For example, reading, okay, some creating works and some art, everything will be change in this delirium condition. So it results in confused thinking and lack of awareness of someone's surroundings. So they will not thinking about who is around me, okay, what will happen. So already they will have some knowledge regarding something. They will their intelligence and everything already they have. But in the case of delirium, what they will happen, they will lose the awareness of surrounding, they will lose the knowledge what they had. So the disorder usually comes on fast, within hours to few days. So this delirium can be start or it can develop within hours. Okay, for example, the person is looking like a normal person, but in this condition what will happen, the person is suddenly changing his mental abilities. Suddenly they will shout, suddenly they will dull. Okay, suddenly they will think something is going to be happen, like that. That is condition is delirium. Delirium is nothing but confused thinking and a lack of awareness. So the next disorder is Alzheimer's disease. So until now we have seen the psychiatric disorders. Okay, but this Alzheimer's disease is a neurotic disorder. So in the psychiatric disorders there are two types. First one is a psychosis, and next one is a neurosis. So, in this, what will happen? Neurosis are the disorders which are caused by the damage of the neurons, brain cells, okay, nerves, synapses, and whatever the structures are damaged. If the disease is developed from the damage of the brain cells, those are called neurotic disorders. Okay, so when the psychotic disorders are nothing but mind function. Normally they will have the normal brain structure and everything, they will have the normal condition, but the mood and mind will be changed in these psychiatric conditions. So in the case of neurotic conditions, they will have the structural loss of the brain cells. So Alzheimer's disease also a progressive disorder that gradually destroy the person's memory, ability to learn, reason, making judgment, and communicate, carry out the daily activities. So here is what happening. So the person having a gradual destroy of the memory due to the abnormal develop of proteins in and around the brain cells. So here I am saying there is a abnormal protein metabolism. Okay, that is nothing but abnormal buildup of proteins in the brains. So there is physically and structurally there is a damage in the brain. So that's why the person is having developing of the Alzheimer disease. So individual with behavior such as anxiety, so they will have the anxiety, suspiciousness and agitation, as well as delusion and hallucination. So delusion and hallucination commonly we will see in the schizophrenia conditions. So delusion is nothing but a false belief. Hallucination also nothing but there is nothing, but they will think there is a something. So the next disorder is anxiety disorder. So commonly everyone will have the anxiety, but in this condition the person having a more anxiety for simple reason only they will getting the anxiety. Okay, for normal people they will understand the situation and they will act according to the situation, but in this anxiety disorder the person looks like normal, but if for a small reason, for a small incidents they will get the more anxiety. So more anxiety can cause for the self harm. Self harm is nothing but killing self. So anxiety disorder is a chronic feeling of overwhelming anxiety and fear. So they will have the over anxiety and fear unattached to any situation. So here I'm saying unattached. So they don't have any relation with the situation, even though they will get the anxiety. For example, in the classroom, the teacher is scolded the one student, but in this condition of the students, what will happen? They will they will develop the anxiety. If the madam will be scold for me also. Okay, if she scold, what I have to do? Okay, like that other students also they will think that is anxiety, and that can grow progressively worse if not treated. So if they don't take any treatment, this anxiety disorder can develop or can increase more progressively. Okay, and this anxiety is often accompanied by physical symptoms such as sweating. So when they get anxiety, so commonly we can observe the sweating. Okay, and the cardiac disturbances are nothing but we can feel our cardiac heartbeat. So commonly we will think, okay, commonly for us also in in the situation of anxiety we can hear the our heartbeat and shaking of our limbs. So some people they will get the diarrhea and some people get dizziness. So in the case of anxiety some people will fall on the floor. And generalized anxiety disorder, panic disorder, and agoraphobia and obsessive compulsive disorder. So all these are all these disorders are related to the anxiety. So for the people who are all having the more anxiety, they can develop or they can reach to the these disorders also. And it is a post-traumatic stress disorder. Okay, obsessive compulsive disorder and post-traumatic stress disorder. It is nothing but the people are depressed. Okay, the people will be depressed by loss of someone. Okay, by the loss of someone. For example, if you lost a loved person, what will happen? You may get the severe depression. So in the depression only your mind will be changed, and some psychiatric disorders also can be developed. That is nothing but post traumatic. Post is past, already happened. Traumatic is nothing but injury. And stress disorder, stress and depression is considered as a anxiety disorders. So the next question is, next disorder is Asperger's syndrome. Asperger's syndrome. So it is characterized by normal language and intelligence and development, but impaired social communication skills as well as difficulty with transitions or changes. For example, in this type of people, they have the more intelligence. Okay, so they have the capability of calculation, so they will read anything, so they will understand anything. But those people cannot mingle with other, so they don't understand the what is society, so they don't understand how to cook. Okay, some other qualities they don't have. So in this condition of the patients, they will have the capable of intelligence and but they have the impaired social communication skills. So commonly we will say, so a person is capable of study anything, but he don't have the understand about other people. That is nothing but communication. So it is this condition is called as a Asperger's syndrome. So the next one is a attention deficit disorder. So this disorder commonly we see in the children. So a biological based disorder that include distractibility and impulsiveness. Okay, distractibility is nothing but changing of the thoughts. For example, a child is thinking about one situation regarding one thing, but suddenly the distract means changing or jumping of the thinking tends to act without thinking. Okay, and recent research suggests that attention deficit disorder can be inherited nothing but from by birth itself from the parents. So the children may get this kind of disorder from the parents and maybe due to an imbalanced neurotransmitters. So the neurotransmitters are nothing but dopamine, acetylcholine, okay, noradrenaline. So this kind of neurotransmitter imbalance can cause for the attention deficit disorders in the children and abnormal glucose metabolism in the central nervous system. So it is also a common a one type of cause for the developing of ADD. That is nothing but attention deficit disorder. So the next one is a attention deficit hyperactivity disorder. Okay, so in this condition, the children with hyperactivity, attention deficit hyperactivity disorder are unable to sit still. Okay, so some in normally some parents they will complain that my child is not standing, he's always walking, he's always running, and he's doing the activity very fast. Okay, so that is nothing but ADHD. So they may walk continuously or run or climb around when the others are seated. For example, all the students are sitting quietly, but this kind of students they will always talking or they will always doing something. They don't bother about the other situation, they don't bother about the around what is happening, but they will do what they want or often talk when the others are talking. Okay, so it is a normal one. So when they are talk, these people also can talk, but abnormally they will continuously making noise, continuously running, okay, continuously crying. So these are all the clinical features we can see in the attention deficit hyperactivity disorder. So the next one is autism. Autism is commonly we heard that is autism is typically appears in the first 3 years of the life. Okay, in the children toddlers age, 3 years of age is called toddler. So although there may be signs of in infancy such as eye contact and uncontrollable tantrum. Tantrum is nothing but excessive crying. okay, excessive crying, and showing no interest in people, including their parents. So, in this condition, what will happen? So, see, in this picture, the child is looking different. Okay, the child is looking different. This condition can call autism. So what will happen? So this kind of children doesn't have interest towards the parents and other people, so they always sit normally. Okay, they don't do work, they don't do study, so they will not play with the other students. So they may pursue strange repetitive activities. Repetitive activities are nothing but doing the same work again and again with no apparent purpose. So there is no purpose, even though they will do the same activity repetitively again and again. Some people with autism can function at a relatively high level. So some children or some people can be develop or can be increased more high level with speech and intelligent intact. So they will have the a normal speech and intelligence, but they don't have the capability to do the works. However, some serious learning problems and language delays are, and some never speak. Some people have the serious learning problems, that is nothing but learning about subjects, for example alphabets and numbers. Okay, to understand, they don't understand the what the teachers are saying, what they teach, and language delays, so they don't speak clearly the language. And some people, they don't speak even. So whatever you speak, the this kind of patients doesn't speak anything. So the next disorder is bipolar disorder. So, bipolar disorder is also known as manic depressive illness. So, bipolar disorder is nothing but manic depressive, combination of manic and depression. A serious illness that causes shifts in the person's mood. Okay, what's happening here? The person's mood will be changed or shifting from one place to other place, and energy and ability to do function, and dramatic mood swings are nothing but changing of the moods, can move from high feelings of extreme euphoria and irritability to depression, sometimes with the periods of normal moods between. Manic episodes may include such as behavior as prolonged periods without sleep, so they will think they don't even sleep, and uncontrollable shopping. So this uncontrollable shopping commonly we will see in the girls. Okay, so each episodes of mania and depression can last for hours to weeks and several months also. So bipolar disorder is nothing but a depressive illness. Okay, they will have the continuous depression. For to avoid the depression, what they will do, the uncontrollable shopping. So they are avoiding the situation, and each mania and depression can last for hours to several months also. So the next disorder is catatonic. Catatonic is nothing but a marked psychomotor disturbances. So here what's happening? Psychomotor. So there is a relation between the psycho and motor. That is, motor is nothing but related to the nerves, and psyche is nothing but mind. So there is a disturbance between the mind and the nerves that may involve stupor. Stupor is nothing but sudden loss of consciousness, instability, and mutism. Mutism is nothing but not talking anything. Mute. Negativism, rigidity, purposelessness, excitement, and inappropriate brazy posturing. Brazy posturing is nothing but they will stand like that only. Catatonic schizophrenia. So in the schizophrenia, catatonic schizophrenia is a one type of disorder. So it is a form of illness characterized by tendency to remain fixed stupor state for a long period. So in this condition, what's happening? The person will be stand like that for a minutes to hours. So this catatonia may give way to short periods of extreme excitement. So suddenly what will happen? The person can have the excitement. Excitement means enjoyment, happiness. Suddenly they will get. So this is nothing but catatonic schizophrenia. So the next one is the delusion. So I already said that a belief that is false. Okay. For example, there is a rope, but the person will think there is a snake. That is nothing. It is a simple example for a delusion. A false belief strongly held in spite of evidence that is not to be true. It is not true. That is not a snake, but the person he is thinking that it is a snake, especially as a symptom of mental illness. And next one is dementia. So dementia is a condition of declining mental abilities. Okay, all the mental abilities or all the mental capabilities will be declined. Declining is nothing but reduction or decreasing, especially in the memory. And individual with a dementia may have trouble doing things used to do, such as keeping checkbook and driving a car safely and planning a meal. They often have the trouble finding the right word and may become confused when given to many things to do at a time. So what will happen in the case of dementia? For the normal people, they don't have the timetable for brushing, bathing, and eating. But in this condition, what will happen? Say they are continuously losing their memory. At what time, what I have to do? They already prepared in the diary, that is checkbook. Okay, checkbook, they will write the at this time I have to eat, at this time I have to go for the shop, at this time I have to go for the office. Like that everything is arranged in the checkbook. So individual with the dementia may also experience changes in personality, become aggressive, paranoid, and depressed. So in the dementia the people can be aggressive. Aggressive means excessive shouting or shouting on others. Excessive aggressiveness can be developed, and paranoid or depressed. Suddenly they will have the depression. So the next one is a depression. Everyone will have a depression mood. So in the psychiatry, a disorder marked especially by sadness. So normally everyone will have the depression when they, for example, when the student is failed in the exam, what will happen? So he will be depressed. So for someone, other people is not talking means what they will do, they will go for the depression. So like that, inactivity, sadness, inactivity, difficulty with the thinking, and loss of concentration, a significant increase or a decrease of appetite. So sometimes the people will have they don't they will lose the concentration on other works in the case of depression. So continuously they will think about the which reason is cause for the depression. So based on that only continuously they will think and they will go for the depression. So at the time what will happen, they don't concentrate on the other words, and significant increase or decrease the appetite. So some people when they depress they will eat more and more and more and more. So for some people they don't eat anything, and time spent sleeping. So they will sleep continuously or they don't sleep even 1 minute also. And dejection and hopelessness, and sometimes suicidal thoughts also will be coming for the depressed patients. So attempts to commit suicide, some people can go and attempted the suicide also. So depression can range from mild to severe. Okay, the depression can be categorized into mild to severe, and it is very treatable with today's medications and therapies. So nowadays in the psychiatric medicine we can easily treat the depression condition. So the next one is a obsessive compulsive disorder, that is nothing but OCD. So, a disorder in which individuals are plagued by persistent, recurring thoughts and obsessions that reflect exaggerated anxiety or fears. So, in this condition, what happens? The person is continuously doing the same thing. For example, hand washing. So, in this type of patients, they will think that they are carrying the pathogens on hand. For example, before eating, we commonly wash our hands, but in this condition, they will continuously washing. So that is nothing but obsession and compulsion. Obsession is nothing but mind. Compulsion is nothing but uh, taking into the action. Okay, so in the mind they will have the some doubt, so to clarify that doubt they will continuously doing and doing. So that is nothing but the best example is continuous hand washing. So typical obsession includes worry about being contaminated and fear of behaving improperly and active violently. So sometimes they act very violent. Okay, obsessions may lead to the performance of ritual routine compulsions such as washing hands, I already said that, and repeating phrases or hoarding. Phrases are nothing but repeatedly they are saying again and again and again. So they will say the same thing but again and again. So the next one is a panic disorder. Okay, panic is means anxiety. Okay, over anxiety. It is an anxiety disorder in which individual have feeling of terror. Okay, panic is nothing but over anxiety. So in the situation, the people are become very anxiety. Okay, or when the anxiety increase, it reach to the panic. So sometimes they will behave very terror and that strikes suddenly and repeatedly with no warning. Without warning, they will have the over development of the anxiety. So individual cannot predict means some people they don't know what happening. So when an attack will occur and they may develop intense anxiety between episodes. So so this kind of patients will have the episodes of development of anxiety without any prediction is nothing but without knowing, and worrying when the next one will strike. So they will worry about the next time what will happen, next time when it will come, panic. Okay, so anxiety I all they already experiencing, and they will control the anxiety, and they will have the fear about the next time what when it will be occurring. So that kind of fear also they will have. And the symptoms can include heart heart palpitation is nothing but feeling of our own heartbeat, that is nothing but palpitation, and chest pain, discomfort, sweating, trembling, tingling sensation. Okay, a feeling of choking, fear of dying, fear of losing control, and feelings of unreality. So this kind of clinical features we can see in the case of panic disorder. So panic disorder is nothing but when the person having over anxiety. In the case of over anxiety, it can lead to the panic. So the next one is a phobia. Phobia is nothing but fear. Okay, in the phobia also there are so many types are there. So mainly the phobia is an intense, sometimes disabling fear reaction towards the specific object situation poses little no actual danger. For normally these kind of people who are all having the fear, excessive fear and phobia, there is nothing danger, even though they will have the phobia. So in these types, there are so many are there: agoraphobia, magophobia, and like that. There are so many are there. The level of fear is usually recognized by the individual as being irrational. Okay, other people are can easily observe the this kind of people. That is nothing but phobia. So the next one is the postpartum depression. So postpartum, when we call the postpartum after the delivery of the baby. Okay, so in the picture you can see the mother is carrying a baby and looking like some depression. Okay, it is nothing but post traumatic postpartum depression, or some people can develop to the postpartum psychosis also. It is a so postpartum depression is a potential serious condition that occurs within 6 months after the childbirth. So in which a woman feels extreme sensation of sadness, despair, anxiety and irritability. So due to these reasons the mother can develop to the postpartum depression. So the next one is, it is very important topic, that is schizophrenia. So schizophrenia is a common disorder for most of the people. So if you see the psychiatric ward in the psychiatric hospital, most of the people are related to the schizophrenia condition only. So in the schizophrenia also there are so many types: catatonic schizophrenia, paranoid schizophrenia, like that. So schizophrenia is nothing but psychotic disorder characterized by loss of contact with the environment. So in this condition the patient, they don't have the any relation, any contact with the environment. So what is happening in the environment, what is going on, who are there, what they are doing, they don't know anything. And noticeable deterioration in the level of function in the everyday life, disintegration of the feeling and thought, conduct. Individual with schizophrenia often hear internal voices, okay, internal voices not heard by others. So here is what's happening in the tactile hallucination. So this is called tactile hallucination. So in this condition the person is having the continuously someone is talking. Okay, so the patients are thinking that someone is talking with me, someone is talking, and someone is standing over there talking with me. But normal people, they don't hear anything. So that is abnormal condition, that is nothing but schizophrenia. And the things that other people cannot be observed. So in this condition delusion also can have the symptoms also may include disorganized speech means in relation speech, okay, irrelevant speech, and grossly disorganized catatonic behavior. And the individual with schizophrenia are have the marked impairment in the social and occupational function. So in this condition the patient cannot do the social activity normally, and they don't work normally in the office or working area also. That is schizophrenia. So the next one is the stigma. Okay, stigma is nothing but a mark of shame and disgregate. Okay, they in this condition the person is feeling of shame in front of others. Okay, a sign of social unacceptability. So in this condition the people are thinking that others don't like me. For example, unbeautiful girl, they think that I'm not beautiful, so that's why others, they don't talk with me, they don't share anything with me. So like that character we can see in the stigma condition. So the next one is a hallucination. So hallucination is nothing but perception of having seen, heard, touched, tasted, smelled something that wasn't actually there. So I already said that hallucination is nothing but there is nothing. Okay, there is nothing but the patient are thinking that there is something, that is nothing but hallucination. I mean, dreaming. Okay, dreaming. So the last one is a mania. So mania is a condition in which you have a period of abnormally elevated extreme changes in the mood, emotions, energy level and activity level. So what happened in the case of mania? Suddenly the patient mood will be changed and excitement, extreme excitement will be going to happen, and emotions. For example, normally the normal person, they will cry normally, okay, for a simple reason. But in this condition the patient is, even there is a small reason, okay, even there is a small reason, but they are continuously crying and excessive crying, we can see in the case of mania. And this highly energized level of physical and mental activity and behavior. So we can observe the high level of physical and mental activity, that is nothing but excessiveness, we can see in the case of mania. So this is the end of my class, guys. I hope you all understand about the psychiatric disorders. Thank you for watching. Please subscribe and share with your friends.